Welcome everyone, and thank you for being here. Many of us couldn't be here due to conflicting commitments, and also perhaps they are now enjoying their summer, and also many are patient themselves, and it's not easy to always to be in all the initiatives. Today we are going to talk about the funding. This is one of the central issues that we try to cover, because it is a recurring issue in all our conversations. When we meet in person or online, we usually talk about the funding. Because it is important to sustain our activities, to develop our activities, to ensure our independence. And we always try to diversify our ways of how we are funded. Like perhaps you know that we have been members of European Patients Forum for almost 3 years, like more than 3 years, and we always try to contribute to their activities and to benefit from their initiatives, like really very useful and precious initiatives that they are carrying out. Like EPF, I always encourage our members to go to their websites to familiarize with their activities. What they are doing is really very precious. And for this initiative, for the funding, giving a capacity building webinar to our members, the first thing we thought of is asking EPF for help. And they responded, unsurprisingly, very quickly and very positively. And they have extended expertise and experience in this issue. So today, Bianca Pop from EPF and Gözde Susuzlu from EPF, of course, will give us their insights, and I will let them present themselves whenever they take the floor. But before, let me also give you some housekeeping rules. So we will have a presentation for more or less 20 minutes. Then we will have a question and answer session. And in the meanwhile, if you have a burning question, or questions that you don't want to forget, please use the chat box to let us know. Please turn off your computers. No, please don't turn off your computer. Turn off your microphones when you don't use them. And there won't be any break because it's only 1 hour and a half. So it is relatively short. And yeah, as I said, session is recorded and will be available afterwards. I will give the floor to Bianca.
Thank you very much, Yalcin. Maybe in the meantime, Albino, our project assistant, who is also joining the webinar, can try and share the screen so everyone can see the slides.
Yes, I'll proceed.
Yes, okay, now I can see the slides. Okay, great. So hello, everyone. Thank you very much for joining this webinar. Just to introduce myself very briefly, my name is Bianca Pop. I'm currently working as project officer at the European Patients Forum, and I have joined the team in March 2023. Since then, I've been working and involved in several project proposals. For those who are not familiar with our work, EPF, so European Patients Forum, is an umbrella patient organization that works with patient groups in public health and health advocacy across Europe. And actually, our members represent specific chronic disease groups at European level, and some of them are also national coalitions of patient organizations. So today we'll try and cover an important topic, which is the EU funding work, and we'll try and share with you our key learnings. This is our own experience and perspective, because we all know that EU funding is a very broad and very niche topic, and it can get very detailed, and often the questions that people might have can be very specific to their organizations and from a profile to another. So today I'm going to share with you our key learnings from our perspective and try and give you an overview of the EU projects, more specific EU programs, more specifically Horizon Europe, including IHI, so Innovative Health Initiative, as well as EU for Health program, because actually these are the programs that EPF is very familiar with. Then we'll have a look at some supporting materials, and also I'll try and give you some insights about the national contact points and national focal points, but I'll get back to this in a bit. So it's going to be a lot of information in my presentation. However, you will have the chance to address any question to me and my colleague, Ghost Debrix, who is also joining the webinar. Please feel free to use the chat box. It's up to you. So let's get started. Before I deep dive into more details, I would like to kind of give you a very brief introduction of what the EU funds are. So actually, what is the EU funding? So EU funds refer to funding opportunities that are coming from the European Union, and they are actually one of the means of the European Union to kind of fulfill its political priorities, which are quite crucial for the implementation of the projects and actions which are distributed within its multi-annual budget. So just to give you the background information, the multi-annual financial framework is the EU's long-term budget, and it runs for 7 years. We are now in 2021-2027 period of EU funding, and this is actually the biggest budget that we ever had. So on that note, of course, EU funding is definitely an opportunity to develop something new and different, connect and influence EU policies, and also collaborate with other stakeholders and build synergies and future collaborations. However, EU funding is very competitive and demanding, and we all know that, in the sense that you also need to comply with strict requirements, conditions, and criteria in terms of the reporting and delivering objectives. So just a key thing here is that funding programs are very thematic. We have some of them are focusing on education, environment, and of course, health. This is our main focus today. And as I already mentioned, so the main purpose of funding programs is to push and translate EU policies into action. And so from EU policy, EU policy actually becomes program, and then the program translates and turns into project. Albino, I think you can move on to the next slide. Yes. So as you can see here, a key point is to distinguish between grants and tenders. So one of the ways to get funds from the European Union is through a procurement, which basically needs to be processed previously as a call for tender, which differs from call for proposals. But I just wanted to take the chance to kind of distinguish between what is a call for tender and what is a call for proposal. But our main focus today is going to be on call for proposals. So through call for proposals, EU Commission grants and allocate financial support to develop organizations leading projects in line with EU's objectives, whereas through a call for tender, EU Commission award procurement contracts when they need to purchase like a specific service or supply or work in a context of an external action. So a call for tender is not directly linked to the project. Next slide, please. Yes, so this is about the relevance of the call topic. So one of the first things to identify when deciding to apply for a call for a proposal is the relevance of the call. So you really need to identify any synergies of the project you have in mind with the policy and strategic objectives of your organization, and then define what are the long-term impact. And we highly recommend you to, this is what EPF does. So you should ask yourself how your organization might benefit from the project in the future. And usually the results of an EU project can translate into research, capacity building activities, such as trainings for patients, and also policy papers. So, but again, just bear in mind that for your project, you always need, and especially for your proposals, when you are drafting your proposals, you need to keep in mind that your project really needs to kind of identify the EU policy and then respond to the key requirements and objectives that are settled in that call. Some key recommendations from our side. So you should ask maybe some questions before submitting any proposal. One of them can be related to your goals. So what do I want to achieve with a new project? And because obtaining funding is not the only interest, an European project grants the opportunity to also create solutions and explore potential developments and collaborations. Another question might be about what is the added value, what I can bring to this project. So at the time of participating in a project, your organization should also bring, of course, its expertise, experience, and knowledge. So the goal is to identify your strong points and to put them in value. And perhaps one last question would be about the resources. So, and the necessary resources. So, do I have actually the necessary resources? Because to participate in your project, you always need to kind of take some risks because some of them, in terms of funding, they are not covering the full cost of the project. And also one last thing, from our perspective, a key thing to also consider is to choose the right role in the project, because usually you can join the consortium as a coordinator or a partner. So basically the coordinator is the one managing the whole project and has a good previous experience in European project, and of course it comes with a lot of time investment. You might need a fully dedicated project manager and a project management team. Whereas you can also join as a partner, and this is something that EPF is very experienced, has a lot of experience. We are usually joining as partners, work package leaders, task leaders in projects, because it does not require that amount of time investment as it does for the coordinator of the project. Next slide. Yes. So here's an example of EPF, and this is how we work as an organization. So basically, EPF Secretariat is divided into several teams, and our project team has a cross-cutting role, as you can see here, in the sense that we are coordinating with other teams the work in projects. And so as you can see, we have a team that takes over the capacity building activities. Another one is focusing on policy development, policy papers, and also, of course, communication and dissemination team. And on that note, EPF has developed a strategic approach in project. And our main is actually to maintain a relevant and impactful project portfolio, which needs to be really aligned to our values, strategic goals, and priorities. And this is also to say that this is why our projects team kind of have a cross-cutting role. For some specific project, it is very specific, and it's different from a project to another, because some of them are focusing on HDI, so health technology assessment. Some of them are focusing on medical devices, and so on and so forth. So it really depends on what the needs are in that project from our side. Next slide, please. Yeah, so this is about how to get involved. So it's just to illustrate the EU funding programs that EPF has been involved in. We have basically Horizon Europe, which has quite a big budget. Also with the IHI, so Innovative Health Initiative Program, as well as EU4Health. But the key point for some projects is that for many of them, we have those national contact points who are the absolute expert on that specific project, and they can really help and answer all the questions and provide you with the right answers and more technical details of that specific program. Next slide. Yes. So this is actually a more practical one because I have included here some links. So how to search actually for funding opportunities? Well, EPF is using mainly and primarily the EU portal. So it's the first one because this is actually the one that is managed by the EU Commission, and this is like the main tool where the European Commission is publishing the open calls for the programs. I have already included 2 additional ones for those who are based in US, and also there is a way to kind of get involved through the national programs. And actually, you need to reach out to and check out the open calls that are available on the government portal. Next slide. Yeah, so this is about the main challenges that EPF has faced over the years. So among them, as you can see, we have the lack of human resources or capacity, in the sense that you might have like less staff members in your team compared to other partners involved in the project. So your organization really needs to kind of have the human and financial support to kind of implement the project. Also because when you start implementing the project, but even in the draft process, there are like a lot of requirements and administrative criteria that you need to comply with. And also, it can be challenging if you have, for example, lack of expertise on technical matters. What else? Lack of understanding of patient organization needs from other partners. This is something that should be mentioned as well. And EPF always try and encourage our partners to think and act in a patient-friendly manner, because the main purpose is to kind of illustrate patient perspective on behalf of our large patient community. And of course, the high competition. Next slide. Yeah, so this is some practical insights about how you can find your consortium partners. So the most effective way of getting into and building a consortium is to use your existing professional and personal contacts. And of course, there are other ways, but the key thing is to kind of have your EU and build your EU network. Among the other ways that can be also explored, there is also the partner search function. So if you click on the EU funding and tender portal, there is a partner search function. And so this allows you to look for partners who already have ongoing projects, and to also browse in their database of the registered organizations. So you can search, for example, by keyword, geographical area, funding type, and this tool really allows you to contact representatives from those organizations. Also, a good opportunity to network and identify potential partners is to participate in webinars and also info days and other events. For instance, a lot of EU programs, when launching a call, they organize those info days, where they usually provide and present the goals of the program, the main characteristics characteristics of the call, and there are suggestions and recommendations to prepare the best application possible. So, for example, from our team last year, our colleague attended the info day for the IHI, so Innovative Health Initiative. It happened last year, but if you check, so at the last of my presentation, there is a slide with all the necessary materials and the links as well. So if you go on the IHI website, you will see that there is a section and with the presentations of the open calls and also the recording. So you can also watch the recording if you missed the info days. Next slide, please. Yes, so this was my first part of the presentation, which was more about the key learnings, some insights from our side. And the next, so the second part is more about the programs that EPF has been working on, Horizon Europe, EU for Health, and IHI. So indeed, Horizon Europe is bigger than ever and is primarily focusing on research and innovation activities. And for the ongoing period, 2021-2027, the European Commission has allocated 95 billion euros funding. And so if you move on to the, so yeah, you can just, still on this on this slide, there is basically the Horizon Europe program is working according to the work programs that are updated by the EU Commission every year. And if you go to the next slide. Yes. So basically Horizon Europe is divided into 3 core pillars, as you can see here. So pillar 1 is focusing on excellent science. Pillar 2, it has 7 clusters. Health is one of them. But it also tackles topics such as climate, digitalization, environment. And pillar 3 is more about innovation. So from our experience in projects, we've been involved in calls that kind of tackled the cluster, the pillar 2, cluster 1, which is obviously focusing on our main area of work. Maybe good to mention that there is a lot of potential for civil society and communities to kind of play a role in delivering in these topics. Also in pillar 1, there might be some opportunities, especially for the Marie Curie action, because it allows researchers from anywhere in Europe or from an associated country to kind of come and work in the organization and on a research topic. So yeah, as I said, if you move on to the next slide, next one. Yeah, so as I said, EPF's main focus is on pillar 2, cluster 1, which tackles actually health. And it delivers on 6 destinations in accordance to the strategic plan. So as you can see, we have one of them is the one related to staying healthy in a rapidly changing society, tackling diseases and reducing disease burden, ensure access to innovation, and many more. Next slide, please. Yes. So this is just to point out that actually, yeah, okay, Horizon Europe program is the biggest program. Because it also focuses on research and innovation, and patient organizations are really interested in kind of the open calls available for each destination, cluster, and then pillar, cluster, and then destination. But also there might be other opportunities to kind of create synergies with other projects, and EU for Health. As you can see here, there are a lot. Life, Digital Europe, EU for Health is one of them. ESF, so European Social Fund Plus. But our main experience is actually in EU for Health program, which is kind of a complementary funding program to Horizon Europe. Next slide. Thank you. So EU for Health program is actually a response to the COVID-19 pandemic. because of course the pandemic had a major impact on patients and healthcare providers, and the program actually focuses primarily on healthcare assistance, but there are of course opportunities for NGOs to be involved. So there is a way for us to kind of build a consortium and partnership with health system bodies. And EU4Health is focusing actually on key topics such as improve health sector in European Union, protect people in the European Union from serious cross-border threats, improve medical products and medical devices, and strengthen healthcare system. And this actually falls under four strands, which is crisis preparedness, health promotion, disease prevention, health systems, digital, with a cross-cutting focus on cancer. Next slide. Yeah, the operating grant. So this is one of our success story, if you want, because this year EPF submitted call for proposal through EU4Health program and for an operating grant, and we receive a positive response and the green light from the EU Commission. So this operating grant is now ongoing. But just before I focus on the operating grant per se, I would like to kind of distinguish between action grant and operation grant, because maybe you are not aware of what the difference is. So as a general information, the grant is actually a financial support awarded by the contracting authority to the beneficiaries, so to the NGOs in our case. So there are like two types of grants: action grants that fund actually a specific action intended to help achieve the policy objectives. So it's basically it links to the program. So policy translates into program, and then the program into action. We call it project. And then on top of that, there is also another opportunity to get fund, which is the operating grant, and it funds the operating cost of your organization when it comes to follow an objective that support the EU Commission policy in a given sector. So the operating grant cannot be linked to an ongoing project, for example, because you cannot I mean, there is a specific budget allocated for the operating grant, but it's more about sustaining the organization, not a specific project, EU project. And some key principles and rules: there is a transparency and equal treatment. So grant awarded process is public and fully transparent. The procedure is fully transparent. And of course, it guarantees the non-discrimination of all beneficiaries, all applicants. Nationality rule is also a key thing. So applicants for grant contracts must be established in an eligible country. And for this, you really need to check very closely and deep dive into the call document, because it might be different from a call to another. No profit rule. So the action covered by the grant may not generate profits. Co-funding, of course. Grants usually covers only part of the eligible cost, and you might need to kind of co-fund. So your organization needs to support the rest. Non-accumulation. So your organization as a beneficiary may not receive no more than one grant per year, and no more than one operation grant per financial year. And also good to know as well that there is a rule about the non-retroactivity. So grants may not be awarded to actions that are already completed or have already started. And when it comes to the operating grant more specifically, so yeah, as I said, it provides the general financial support to the organizations who kind of help to achieve one or more strategic objectives of the EU4Health program. So the operating grant is linked to the EU4Health program. And they, as I said, they do not support a specific project like action grants, but it's more about supporting the annual operating budget of the organization. Next slide. So the last program I'm gonna talk about is the IHI, so Innovative Medicine Initiative. Well, initially it was called Innovative Medicine Initiative. Now the name has changed, so it's Innovative Health Initiative. But this program started in 2008 as a public-private partnership between the European Union and the European pharmaceutical industry. It is still a public-private partnership. So the public member in the partnership is the European Union, represented by the European Commission. And there are also some industry members, such as FPA, including Vaccines Europe, Europa Bio, and MedTech Europe, that can also join the consortium. Also because IHI is also focusing on research and innovation, and they kind of try and bring on board the medical technology and digital health and vaccine industries. In terms of co-funding, so for all beneficiaries and all activities, the funding rate is 100% of the eligible cost. Next slide. Yeah, so a key thing here is that for the IHI program, there are two ways to kind of get involved. There are the single stage calls and two-stage calls. So for the single stage ones, you need to submit the full proposal at once and also build your consortium together with pre-identified the members from the industry. And whereas for the second stage call, it happens like in two steps. So first you submit a short proposal. I think there is a number, like a page limit of 20 pages per proposal. And then if you succeed, you move on to the second stage. And then at that stage, the industry is joining the consortium as well. So in the end, when you submit the latest version of your proposal, it's going to be like all together, so public and private members. But in any case, all applicants requesting IHI funding must be part of a short proposal. Next slide. Next one, because this is about the two-stage. Yeah. So this is something I already mentioned in the introduction. This is very useful information, and the key point is that not many organizations or partners are aware of the national contact points. So basically, they are kind of support bodies that can assist you in the implementation of the EU program. And they can also help you and provide information, advice, guidelines to all potential applicants and beneficiaries through the project life cycle. And also an important information, they are based in each member state, and they provide support and guidelines in their own language. And yeah, in a manner that actually it would be impossible for the EU Commission and its agencies to kind of act alone. So I have included here the link for the national contact points under Horizon Europe, but I'm gonna share with you the link to the national focal points for the EU for Health program. I just checked the information before before we start the webinar, and for the EU for Health, there is a way to kind of ask and address your question, not to a national contact point, but they call them national focal points. I'm gonna share with you the link after my presentation. Next slide. Yes, so this is my last slide, and I tried to kind of include as many useful materials as I could. So as you can see here, there are 3 sections. So the first one is dedicated to Horizon Europe. There is the work program 2023-2024, financial regulation. And we really encourage you to kind of have a look and identify whether there is an open call that might fit your organization, and also your human resources and financial resources. There is also the EU for Health program, and then some materials for IHI. But if you want to kind of look for funding opportunities, you should use the main tool, so EU portal. I already include the link in my third, fourth slide, I think, but I'm going to share it once again with you. So in case you're wondering where I should like find an open call, it's on that website, and that is kind of the main tool that EU Commission is using when it launch a call. And with this, I think I finished my presentation. I think that's it from my side. I'm very happy to answer your questions. Thank you very much for your attention.
Thank you, Bianca, for this very interesting and comprehensive presentation. Lots of knowledge, lots of new ideas, and I am sure that we also have lots of questions. We can already see on the chat box some of those questions. What I would suggest is first to take those questions asked on the chat box, and those who would like to ask orally their questions will follow with the oral questions. If it's okay with everyone, I don't know, Bianca or Guzda will take those questions, but I would first start with Lex van Heiden's question, which is, how about request funding for a project we are executing ourselves, such as patient advocate training? And Lex, please do not hesitate to jump in if I did not articulate well your question. So
from
yeah, we have organized and developed our own patient advocate training last year with people from Japan, South Africa, United States, Canada, Slovakia, Germany, Belgium, UK, and this was funded by the Dutch government. But now we want to organize this again, but so far I didn't get any funding. It's only about 25K, just a mini project. Is this possible to get a request funding? And the second question is, looking at European levels, I think there are some big projects with a lot of bureaucracy around it. But are there any clipping levels? So when you request a project of 20K or a project of 2 million, I think they could be handled in a different way to speed up the process as well and to reduce the bureaucracy. So 2 questions.
Yeah, so I can take the first one, maybe related to the patient advocate training. So as far as I understood, it was run at the national level, so funded by the national government.
Oh yeah, it was a global project that was funded by the Dutch government.
Yeah. So yeah, EPF actually does not have like that knowledge and many experience in like those types of funding, because actually our work is especially in project, it's covered by exclusively by EU programs actually. I don't know if they would like to add anything else on that.
But is it possible or not to request funding for such a project?
It's not possible with the programs we actually explained today, but you will see the national link on the presentation where you will have a national contact point where you would be able to find the local funding opportunities. That would be more useful for you probably.
Okay,
more
thank you.
to a national setup.
Well, then let's jump to the next question by Anne-Marie Slemers. What if 2 or 3 patient organizations from different EU countries apply for funding for a specific project? Since Lupus Europe is an umbrella organization, I ask this for our smaller member organizations. Some POs work together. Anne-Marie Slemers, she represents Lupus Europe.
Yeah. So I think it's possible. I mean, patient organizations should kind of build and join forces to kind of build a consortium. So it is still realistic. For example, in there is an ongoing project, IDERA, and actually on one of our work is coordinating with our patient organization, Lung Cancer Europe. So Luce is also one of our members. So there is this possibility to kind of build a consortium and join forces. But more specifically, I just wanted to point out that it really it's different from a call from another. You really need to kind of check like the eligible activities, eligible countries. For Horizon Europe, I think they have like a specific condition. You really have to kind of your consortium needs to have at least 3 legal entities. One of them should be in EU, like from an EU member state. So it really depends from a call to another. We are not EU Commission experts, so we are just trying and bring our own experience.
Maybe on that note, just to add, to understand specifically. So you're saying that if you have different projects, if there is a specific project that you already have in mind, but you're looking for a funding, or would you be a few of you actually together would go for a call that's EU level open, and that would be 2 different scenarios. So would it be possible to clarify that part?
I mean, it's like for Lupus Europe, we are now concentrating on the east side of Europe because the West European countries already are a member of our organization. We have a lot of trouble having joined East European countries, a member or creating even a patient organization. And my thing is like we now have Lithuania, Estonia, and another, I kind of recall it, but they want to work together because they are very small countries or a small population and small group of lupus patients, and they can work together because they have some kind of same language somewhere in between the 3 languages they all speak. And if they want to work together on a project because they are connected with each other with the borders, so it will be a larger country in one, are they able to apply for a funding? And they are small organizations, like 2, 3 people, so they're not, that's what I mean.
Yeah, I see what you mean. So for EU projects, because at this point our expertise, like Bianca said, is at the EU level, there are calls that open, and now they're more and more looking for actually use cases or national coalitions to apply to calls with us, for example, like with an umbrella group and a national coalition. Because of that reason, because the national coalitions or organizations have a lot of network and knowledge about the disease and the country, but they do not have the capacity and the staff members to actually do the coordination. So they usually do accept they do go for small organizations joined with bigger umbrella organizations to the EU level calls. For that, I think you can very well rely on your member organization. That's a bigger organization, actually, like us. We are also supporting our members, and then they need to invite you to those calls either as a partner, like partner of that project call, or it could be associate. So they're kind of a linked party to the other bigger organization, where that bigger organization actually provides you the extended funding. So there are opportunities in this sense, but it's mostly, if you're small organizations in small countries, it's good to check with your member organization that's a bigger joint group that has more access to these calls, and there will be possible.
Okay,
certainly.
thank you.
Thanks. The next question was from Marie-Claude Boiteux. And the question is, are NIH funding available for European projects?
No, yeah. So, I just mentioned the National Institute of Health because they're actually based in US and they're managing like the international fund. But they are not specifically linked to the EU fund, but as your members were already, I mean, have also like an international profile, it was just to kind of point out that you can look into some funding opportunities on their website as well. As EPF, we don't have like any previous experience in those type of funds. But if you are interested, you can just go and check. From the EU perspective, for some calls, especially for Horizon Euro, you might join the consortium as an associated beneficiary or third party. But again, it really depends from a call to another, and you really need to kind of read carefully the conditions.
Thank you.
You're welcome.
Are you happy with the answer, Marie-Claude?
Yes, yeah, that's fine. I just, as we are an international organization, I was wondering how applying to NIH could benefit for a specific European program. So I will have a look. Thank you.
Just on that note, IHI actually includes global organizations very easily, so you would have a higher opportunity there.
Okay, thank you.
Does the Europe Joint Program Rare Disease still exist? And I think Marie-Claude partly answered to this question, but nothing on skin and on rare disorders. Anyone would like to elaborate on this?
So just my comment on nothing on skin and rare disorder was on a slide that was
Oh, my bad.
I saw several topics, but none was specific for skin or rare disorders. This is sometimes a big difficulty for some of us, as applying when you are ultra rare and skin disorder, you mostly do not find any proposal that fits with your project. So this is the big difficulty. And the question about EGBRD, I think it was Karine who asked it.
Yeah, so about the open call for proposals, yeah, so maybe what I would recommend is to kind of read the work program 2023-2024 of Horizon Europe and see whether you can kind of fit, if there is like a call that might fit your any project that you have in mind. Also, like aligned to the conditions and the requirements. I mean, if you don't see like in the destination of the or even like in the call title like a very specific disease, there might be some opportunities to kind of link your work area and you kind of bring your experience on board and join forces with a consortium. It really depends.
But the EGPRD program was really special because it was also developed to to offer grants for new researchers, young researchers, in cooperation with patient organizations. So that this was very special about this type of grant, and it was also part of the Horizon program until 2022, I think.
Yeah.
So it does not exist, yeah.
Yeah, we benefited from EGPRD, yes, in 2022 to organize our international patient meeting in Belgium, but finally they agreed for the grant, and then when we produced all documents, they didn't finally give the total fund they had planned. So it has been really difficult to work with the GPRD. Yeah.
All right. Any other questions that you would like to ask? The floor is open to for the oral questions. please don't hesitate to raise your hand. If not, I would like to ask a question. In our organization, we have lots of members from the UK, and it broke my heart to see that many of them, they are not massively present today. That is, maybe they think that the EU programs are not available anymore for the UK patient organizations. Would you, could you maybe elaborate on this? If the post-Brexit rules apply to the UK patient organization, how they are impacted by these rules?
So yeah, not very specifically, but actually when I attended those info days for Horizon Euro, even for IHI, the EU Commission did mention actually that for UK it's still possible to join the consortium as an associated beneficiary. Of course, this needs to be kind of stipulate and settle down in the call for in the call document, but my assumption is that they can still provide their support and join the consortium. It really depends. I think for Horizon Europe, they are like on the list of the associated countries, but this is something to really, I mean, it's a very sensitive topic and kind of need a very,
On that
specific
note,
approach.
actually, Switzerland is in a similar situation as well, and they've been part of a lot of EU projects for years. And as exactly like Bianca said, they actually get funded by their national authorities, so they have to just show that they are part of the consortium. It's the same for UK, but for Horizon, if I remember correctly, now researchers and research organizations and hospitals are now eligible to join actually Horizon projects, EU projects. They open that, so we have to see how it is with the patient organizations, but research organizations are back.
All right. And if patient organizations join their forces with research organizations, then I think this should be fine.
I think so, but it's something that needs to be carefully checked. I know recently they did grant it back again to the research organizations and hospitals, but I don't know what is the condition for NGOs in that sense, if there is any change in eligibility.
Right. We also have many members from the candidate countries. Are there any specific rules for candidate countries, like organizations representing candidate countries?
You mean the candidates at to join like the EU?
Yes.
Oh, yeah. So for example, I know Moldova is one of those countries. So yeah, they can, I mean, for Horizon Europe, I think they can join the consortium as again, associated country, also because the discussion is under development, the negotiations are ongoing and under development. There might be, I mean, from what I understood, they might be, they can be involved and join the consortium as an associated country, but again, very specific from a call to another.
Yes. Marie-Claude.
Yes, I was just going back to the creation of the consortium. Is there a minimum of different members? Let me say, do we need to be at least one patient organization, one academics, one hospital? Is there a minimum? Does the consortium has to be with all stakeholders, or how is it needed, organized?
Yeah, so for Horizon Europe, for example, as I said, there is this requirement that in order to kind of build your consortium, you need to kind of have 3 legal entities. Well, a legal entities means also someone from academia, an NGO, a company, whatever. So it's not, they did not mention specifically that, okay, an NGO should join the call. at the least from what I saw. Also for IHI, for innovative health initiatives, those consortium, when they are built, like I mean, a lot of members and beneficiaries are joining. And in those consortium, there are, I think, high chances to kind of get on board also NGOs. They really encourage NGOs to kind of come on board.
Okay, thank you.
You're welcome.
Just maybe also one thing, Bianca, we can remind you, remember EU4Health has also sometimes some calls, so it's good to look at those. They do open sometimes calls that you can on your own apply actually. Like we had the recent experience, it's a smaller call, the budgets are much smaller, it's a smaller extended project, so it could be an event. Like in our case, it was an opportunity to hold an event on a specific topic, it was a call. And there you can apply on your own. You don't have to build a consortium. You can be a consortium on your own. But these they really depend on the calls. You have to monitor those closely.
Yes, I'm sharing in the chat the link to the national focal points for EU4Health program and also the EU portal. And if you click on the EU portal, so on the link, on the landing page, you can search from different topics. This is something we really encourage you to explore.
And to be sure, Bianca, those links are also on the presentation slide that you presented. Okay, so
yes,
just
exactly.
To make sure that we will all have it.
And also for the reference. Sorry, also for the reference documents. So there are like a list. There is a list with some documents, materials for each program, and then if you click, the link will direct you to the main page, so to the website.
Mm-hmm. And maybe one other aspect of the issue. Well, you know that many of our members are lacking resources, expertise, people, and applying for these kind of grants can be very technical and very complicated. Do you think there are organizations or people that help smaller organizations to write the bids or to apply for Horizon or other European funds, just supporting them technically?
Yeah, so actually to go back to the national contact points, this is something that unfortunately they cannot do. They cannot kind of help you on drafting the proposal. What they can do is kind of guide you and give you further clarification to a specific question related to the call document, but they are providing free services, so you should not pay for the service because they are appointing for the national authorities in collaboration with the EU Commission. So this is like the rationale behind the whole concept. But yeah, for the draft writing, yeah, that's the issue actually, and they cannot support in this process.
There should be some NGOs probably.
Yeah, probably a consultancy agency, someone that really has like some experience in drafting proposals.
It's a big business, unfortunately, nowadays. It became, and there are some companies that are much more easygoing with NGOs than the others. But we recently, for example, in contact with one, because we want to also have some backup, support for our admin work at the background with the portfolio. They're soon going to come back to me because I mentioned about you and today's event actually to them as well, saying there could be some of our members or our members that might be interested. But I asked them if they have special, rates and special, prices for NGOs and patient organizations, and they said yes. So I will get their, like what is their range of consultancy and how much they charge, and I will get back to you if it sounds reasonable, because it would be a good opportunity. They literally support you from A to Z. If you need, or they can support you in the beginning or in the middle, depending on your needs, and they tailor it around that. But finding small organizations is not very easy with that. It became a big business in the EU.
that would be very, very helpful, because I really look forward to it. And also, I can also I thank you for this reflex that you thought about us, that you thought about this initiative. Any other no cure, no pay options? Sorry, Lex, I didn't get the joke.
Now, when writing a proposal, we have quite some organizations or in fact commercial companies doing this, but there's no guarantee whatsoever, and these are not feasible for us. So I normally write all proposals myself. Sometimes I'm even making myself, but that's only my time investment with no money. But they say, okay, you write, it will just be calculated by the hour, but it's not an option for us. It's not feasible. That's financial risk we cannot bear. So that's why we said to people, if you want to write a grant for us, okay, but only no cure, no pay. We don't want to risk any financials.
Yeah, well, I'm afraid many organizations don't work on those principles, but it is a solid ground to progress. Well, we still have 25 minutes, but if we don't have any more questions or any other comments, we can conclude this session and maybe enjoy the rest of the time. In Brussels, we finally have lovely weather, so we can a little bit enjoy it. But before closing the session, I would like to thank EPF for helping us with this important initiative. I want to thank their lovely team, which are here helping us, helping themselves. Yeah, also, of course, yeah, sharing the success stories from colleagues could be also inspiring and helpful in order to advance, because many of us, we are shying off because we're not feel confident about the outcome of our applications and the funding opportunities. I think this is the conversation that is needed to be continued. It's not an announcement, but we think that in our session at EADV, we are going to have a similar conversation topic. And perhaps we can also, if they are available, ask for EPF's help, but because they're always helpful. In the meantime, please do not hesitate. I call on our members if they want to be in contact with the EPF or ask for more information. I would be very helpful. Not helpful. I will be very happy to help. And then also from the EPF side, would be happy to liaise between our members and the EPF. Voila. Thank you very much for attending, and have a good rest of your day.